A fourth COVID wave is being felt across Europe. Austria announcing just today a fourth national lockdown and plans to enforce mandatory vaccinations there. Neighboring Germany says it may follow suit after COVID cases there hitting a record high. And joining us now to discuss the situation in Europe is BNC's chief foreign affairs correspondent Nayyera Haqq. And Nayyera, none of us want to hear about another wave, but the virus seems to have its own mind.
Indeed, and part of this is the concern of what happens in Europe when it comes to disease like coronavirus, or even when it comes to political trends, tends to happen in the United States just by a delay of a few months. So looking at Europe gives us an idea of what could happen in the United States. Austria right now has one of the lowest vaccination rates in Europe. It's effectively plateaued in the single digits. So what they're looking to do with this rising caseload is to impose not only a mandatory lockdown, but also mandatory vaccinations. And they're exploring the idea of fining people for not getting vaccinated, which is something that politically would not work here in the United States.
And Nayyera, some of the numbers coming out of Europe are confusing, and we need to point that out to our audience, because not all of the countries are using the same vaccine. And in the UK, they decided to vaccinate all people with one dose early on instead of the two-shot regime at first. Should we be paying attention, I guess, to the death rate or the infection rate?
So infection rates will still happen even when people are vaccinated. We know not only about the idea of breakthrough vaccines, but also that transmission can continue even if people are vaccinated. However, the vaccine does limit hospitalization rates and does limit the death rate. So the caseloads aren't, they're the first, the first number that people look at, but the real numbers that tell you how the impact it's having on a society are the hospitalization rates and the death rates. But knowing that there are high infection rates, knowing that it is a winter season in which other illnesses are also going to be prevalent, like the flu, other pulmonary diseases like pneumonia can also set in. This is what has people in Europe concerned because they want to make sure that hospitals don't get overrun. Austria was one of the early places that told us about the risks of COVID, because they ended up not only having their hospitals overflowing to the point where they put ventilators on people in parking lots. And this was well before we saw the worries about here in the United States of ICU beds running out. So they've had an interesting story when it comes to COVID. They also, though, have not necessarily been using the same vaccines we have here. Austria, in particular, has been experimenting with the Sputnik vaccine from in Russia, as well as the AstraZeneca vaccine, which is more prevalent throughout the United Kingdom.
You know, it's fascinating because when this began, we remember the images coming out of Italy when it seemed that this virus knew no boundaries. But a lot has changed since the early days of the pandemic. We have antiviral drugs. We were just talking about the Biden administration buying 10 million doses for the United States of that pill. There's the Merck pill. We now know better how to treat patients. So are we now, even in Europe, starting to be able to better manage this virus?
The management of the virus comes in when you have significant vaccination rates. And that's when you start the idea of, okay, maybe this becomes a virus that gets managed the way the flu does, which is people get boosters every year. That helps lessen the death rates and hospitalization rates. And you ultimately are just living with COVID as any other illness that we've lived with in the United States. The challenge with Europe right now is looking at the places where there are high vaccination rates, like Portugal, for example, has effectively 80%, versus Austria, where they're still in the low digits. That will show us how this virus is really working as part of the global pandemic. Without vaccination rates, though, throughout the world, even the treatment pills will not be enough to make sure that we are out of the pandemic. Again, if you have to stop people from getting the illness as opposed to simply treating them when they get it.
Nayyera, I was fascinated at this stat. Germany has one of the lowest vaccination rates in Western Europe. Booster shots are now being recommended there. More than 30% of the people still don't have their shots.
Indeed, and that's the concern that Angela Merkel has said, that this is going to be a tough fight for them to manage as a country. They are also looking at lockdown measures. They have a federal system like we do, so they have a national government as well as local governments they have to manage in order to be able to implement these, but they don't have the same resistance to masking that we do here in the United States, so that will be interesting to see. But their challenge, of course, comes in from misinformation and disinformation, and also they are very subject to, again, that pull that comes from the Russian side, and so they were at the forefront of the AstraZeneca vaccine development, and it's interesting to see that despite the fact that they were at the forefront of that, many people have still been resisting to getting the vaccine.
Nayyera, as we talk about lockdowns and a fourth wave, what model should we be following in the United States? Should it be the European model that early on gave us the Delta variant, or should we be following the model of Israel that almost fully vaccinated its people?
Israel was also a testing ground for Pfizer, so we were on the front end of this, of making sure that not only were people willing to take the vaccine, but they were willing to actually be participatory in the trials, which also allowed them to get access to the vaccines on the front end too. This is part of the challenge that we're seeing, is that European countries have developed the vaccine. They have had access to it. They are now sitting in the space of making choices, policy choices and cultural choices about how they deal with COVID. But then you look at Africa, where only 4% of the entire continent has been vaccinated. People want the vaccine there, but these pharmaceutical companies have not embraced the idea of letting the patents go so that they can be manufactured and supplied locally. Absent that manufacture and local access, you were going to see Africa continue to suffer because of this illness, and those variants that we were worried about, Delta, a new variant, they will continue. They will start coming out of Africa, and as migration and refugee patterns continue, they will start to impact the rest of the world. So until we solve the problem of vaccinating Africa, COVID and future pandemics will continue to be a problem for Europe and the United States.
Nayyera, 15 seconds left. Is this now the new normal that we are seeing?
That's going to be what we see coming out of Europe, right? Austria, the extreme example of they're doing the lockdowns. We have other examples of countries that have high vaccination rates like Israel and Portugal, and seeing how they manage this next winter. It is likely though, given how chickenpox became normal, how dealing with the flu became normal, that this could be that we are coming out of this where people just accept, they take vaccines, and they deal with whatever minor illness may result.